Hello, my name is Kelly Moran, and the viral disease that I chose to talk about is pneumonia. And this is Bio 214002A microbiology. The next thing I want to talk about is what pneumonia actually is. Pneumonia is an infection in your lung, and it keeps you in bed feeling very sick. It is usually caused by bacteria, viruses, or fungi. In the United States, about 30% of pneumonias are known to be viral. There are many diseases that can cause pneumonia. The viruses that can lead to pneumonia include influenza A and B, which is the virus that is most commonly found in older adults. You can also have respiratory virus, also known as RSV, which is more common in infants and children rather than adults. You can also get things known as coronavirus, influenza virus, and adenoviruses, which is also known as pink eye. Other viruses that more rarely cause viral pneumonia include the herpes simplex, measles, and chickenpox. Many people wonder how viral pneumonia actually spreads. Viruses that cause pneumonia travel through the air in droplets of fluid after someone sneezes or coughs. These fluids get into your body through your nose or mouth. You can also get viral pneumonia after touching a virus-laden doorknob or keyboard and then touching your nose or mouth. Viral pneumonia is diagnosed in a couple different ways. Your doctor's diagnosis will depend on how severe your infection is. If you have mild symptoms, your doctor may suggest blood tests or even a chest x-ray. If your symptoms are serious and you are 65 years or older, or an infant or young child, the doctor might recommend collecting fluids. The doctor may also put a camera down your throat to check your airways. In this slide, you can see a picture of a chest x-ray, and pointed out is where they can see the pneumonia. There are a lot of different symptoms of pneumonia. The first one is cough. The second one is mild flu-like symptoms. You can experience shortness of breath, pain in your chest, rapid breathing, tiredness, or lingering weakness. You'll notice symptoms if you have pneumonia 15 to 25 days after you have been exposed. There aren't that many treatments for viral pneumonia. If a virus is causing your pneumonia, antibiotics won't help, but your doctor may prescribe an antiviral medication. If you have an influenza virus, your doctor may prescribe medications such as Tamiflu, Relenza, or Rapivab. These drugs will keep the flu virus from spreading in your body. If RSV is the cause of your pneumonia, your doctor may prescribe a medication such as Ravizole. This will help to limit the spread of the virus. When you have pneumonia, it's very important to get plenty of rest. Make sure to check back in with your doctor after treatment to make sure that your lungs are clear. It is very important to know how to prevent viral pneumonia. The same steps you would take to prevent the flu also will help lower your chance of pneumonia. You want to make sure you wash your hands often. Scrub them with soap and water for at least 20 seconds before you eat or prepare food. When you're in public places, make sure you use hand sanitizer. Get a flu vaccination each year at the beginning of flu season. There's also a pneumonia vaccine that you can get. You want to stay away from people who are sneezing or coughing, and keep your hands away from your eyes, ears, mouth, or nose. They're still unsure of what exactly the reservoir for pneumonia is. They know that it is not an animal reservoir or insect vector. They believe that it may be the nasopharynx of asymptomatic humans. Streptococcus pneumoniae bacteria are lancet-shaped, gram-positive anaerobic organisms. They are typically observed in pairs, but may also occur singularly or in short chains. Some pneumococci are encapsulated, which means their surfaces are composed of complex polysaccharides. Encapsulated organisms are pathogenic for humans and experimental animals, whereas organisms without capsular polysaccharides are not. Capsular polysaccharides are the primary basis for the pathogenicity of the organism. They are antigenetic and form the basis for classifying by serotype. They are mostly RNA virus, but it can sometimes be DNA. This last slide includes my work cited. Thanks for listening, and I hope you learned something new about pneumonia that you didn't know before.